Let's talk about lymphoma. Specifically, we are going to see all the non-Hodgkin's lymphoma in this series. Before I go into the detail of non-Hodgkin's lymphoma, let me tell you what is lymphoma. So basically, lymphoma is proliferation of WBCs, specifically lymphocytes, which will present in the form of discrete tissue mass. Now, this NHL for lymphomas, WHO has given a classification. In that classification, WHO has taken few criteria. Based on that, they have divided the lymphomas in the various categories. So based on the morphology, based on the immunophenotyping, based on the clinical presentation, and based on genetics, they have given the classification of the lymphomas. Based on that, now let's see the classification. In the classification, if I simplify it, so broadly we'll divide it into the 5 categories. One is precursor B cell neoplasm, then peripheral B cell neoplasm, then precursor T cell neoplasm, then peripheral T NK cell neoplasm, and the 5th one is Hodgkin's lymphoma. Hodgkin's lymphoma, we'll see it later in details, but now let's move on to the non-Hodgkin's lymphoma. In the non-Hodgkin's lymphoma, if we subdivide this, so if it is precursor B cell neoplasm, the subdivision of that category, the lymphoma which will comes under this heading is the precursor acute B lymphoblastic leukemia lymphoma. Then when it comes to the peripheral B cell neoplasm, in peripheral B cell neoplasm, the most important and most commonly asked lymphomas first will cover. Those are follicular lymphoma, mantle cell lymphoma, marginal zone lymphoma, CLL, SLL, hairy cell leukemia, diffuse large B cell lymphoma, Burkitt's lymphoma. For T cell neoplasm, as we have seen for the B cell neoplasm, for T cell also it will be precursor and peripheral T NK cell neoplasm. So for T cell precursor, it will be T cell acute lymphoblastic leukemia lymphoma. For peripheral T cell NK cell neoplasm, in that mainly we'll see the angioimmunoblastic lymphoma, then anaplastic large cell lymphoma, then we'll see mycosis fungoides and Sézary syndrome, then large granular lymphocytic lymphoma, and extranodal NK T cell lymphoma, NK cell leukemia.